administration of drugs using the subcutaneous route. So the purpose of this procedure is to administer the medication slower than the IM and the IV route. So this procedure will undergo steps such as the assessment, planning, implementation, and evaluation. For the assessment, we will assess our patient. We will assess the selected site where we will administer the medication. So the selected site is for the deltoid area of the patient. So we will assess, ma'am, may I start assessing your deltoid area na po? We will assess po if there are any tenderness, masses, or irritations po by the use of palpation. Is that okay with you po? Okay po. So we will palpate it. So, upon palpating it, there are no masses, tenderness, burning, or any irritations or inflammation. So, this site is good for the subcutaneous administration. And then also, we will assess the selected or the specific drug action and the expected outcome of the ordered medication. And then we will assess our patient's knowledge and learnings on the expected outcome and the specific drug action. So, since our patient is 6 years old, we will talk to the significant other. So, mami, dahil po second dose na po ito ni baby, siguro po alam nyo na po kung ano po yung medication. So, ang i-administer po natin sa kanya is yung MMR vaccine, wherein it is the measles, mumps, and rubella vaccine po. Is that okay with you po? Okay po. So, after that, we will proceed on the planning. For the planning, first is we need to assemble all of the equipments to be used. So, we need to have our gloves, our sharp container, micropore, pen, our vial medication, or the correct medication, our wet and dry cotton balls, our 3 ml sterile needle, our filter needle, and alcohol swab. So after that, we need to check the medication administration record or the medication order for the patient, and we will read the label of the medication against it. So for our patient, it was ordered that the patient will receive measles, mumps, and rubella vaccine for 0.5 ml subcutaneously. So, the vaccine here is the measles, mumps, rubella, MMR vaccine. Expiration date is January 1, 2022. So, after that, we will now make sure to read the label of the medication when taken to the medication cart, after withdrawing the medication, and before withdrawing the medication. And then we can now proceed for the implementation. For the implementation, first is we need to perform hand hygiene technique. So, I've already performed hand washing, so now we can just disinfect our hands to prevent cross-contamination, and then we will prepare the medication. So for the medication, we will be having the MMR vaccine, so we will perform the vial preparation. So before withdrawing, we will read the label. So measles, mumps, and rubella vaccine or the MMR vaccine. Expiration date is on January 1, 2022. So now we will inspect the bottles and we will assess the clarity inside the bottle. So upon assessing, there are no cracks. The clarity of the inside is in good condition, and there are no foreign bodies. So now we can proceed on the vial preparation. So, after performing the vial preparation, we withdraw 0.5 ml of the MMR vaccine to be administered to the patient. So, after withdrawing, we will read the label. So, measles, mumps, rubella vaccine MMR expiration date is on January 1, 2022. So, we will label the syringe with the 5 rates of the medication, the patient's name, name of the drugs, time, route, and the dosage. So, after that, we will now make sure to prepare our patient. So, we will prepare our patient by first establishing rapport. So, good day, ma'am. I am Kauri May Emasidro po, and I will be your nurse for today po. I will be the one po who will gonna administer the MMR vaccine subcutaneously. So, to verify your identity, may I ask your mother po? So, ma'am, tanong ko lang po, ano pong pangalan po ni baby? Also po, may I look at your wristlet, baby? So, it states here that your name is Ayana Gale, female, bed number 1. So, is that true? Okay. So, now as we will make sure to explain the procedure to the patient. So, mother, since the patient is already 6 years old, we will communicate to the mother. So, mother, since this is the second time po na ma-administer po yung MMR vaccine kay baby, siguro po alam niyo na po na i-administer po natin yung measles, mumps, and rubella vaccine kay baby. So, it doesn't mean po na when the vaccine is already administered to the baby, hindi na po siya magkakaroon ng mga sakit na nasabi ko po kanina. However po, mother, it will lessen the complications or the intensity or the severity of the said diseases po if ever na ma-acquire po siya ni baby. Is that okay with you po? Okay po. So, baby, later pag tutusukin ka, medyo masasaktan ka. However, I promise na pag nasaktan ka, sabihin mo lang sa akin, okay? And then, magiging mabilis lang yung procedure. Is that okay with you? So, you can cooperate by relaxing your hand, okay? Okay, so after that, we will make sure to provide our patient's privacy by closing the curtains and the door so that our client will be more comfortable. So after that, we will now make sure to select the site or inspect the site wherein we will administer the medication. So I will again perform palpation, okay? So, we will perform palpation on the deltoid area if there are any tenderness, masses, inflammations, or any irritations and burning on the area. So, we need to select the area wherein this area doesn't always being injected. So, this area is the perfect site for the subcutaneous administration. So, after that, we can now perform or we can now don our gloves. So, after putting on our gloves, we can now start disinfecting the area or the selected site with wet cotton balls. So, we will start from the center going outwards for approximately 5 centimeters. And then, we will dispose. And then, in here, we can prepare the cotton swab that we will be using later by putting it above the selected site. So, later on, it will be easily accessible. And then after that, we can now start preparing the needle or the syringe by removing the cap straight off, making sure that the tip will not be contaminated. And then, we need to hold the syringe with our dominant hand with the thumb and our fingers. For when we are aiming for the subcutaneous route, we need to make sure that the angle is 45 degrees by making sure that the palm is facing upwards or the palm is facing, make sure that the palm is facing upwards and sidewards. So when we are aiming for 90 degrees, make sure that the palm is facing downwards. So now we will pinch the skin or the selected site or spread the skin. For you can pinch the skin if the adipose tissue of your patient is lesser, and you can spread the skin if the adipose tissue of your patient is 1.5, or the adipose tissue of the patient acquires 1.5 adipose tissue. So we will pinch the skin of the patient and then we will administer the vaccine or the medication, and then after that we will hold or move our non-dominant hand below the syringe and our dominant hand above, and then we will administer the medication slowly. And then when the medication is already administered, embed the syringe for 5 seconds and then remove it fast and then discard. And then if there are any blood, you can put pressure and put the cotton swab into the area where the vaccine is administered. And then after that, we can now make sure to alert our patient. So, ma'am, okay na po. Tapos na po yung vaccine. Okay po. So then we will remove our gloves. And then we will dispose it, and then we will perform hand hygiene technique or any infection control technique. And then we will document all of the findings on our patient's record. We will document the medication that is administered, the route, the time, the dosage, and our patient's reaction. And then we will also document the expected outcome, and we will assess the patient's reaction after the administration of the medication. So that ends the administration of drugs using the subcutaneous route.